So the federal government, the Department of Housing and Urban Development, otherwise known as HUD, is the largest funder of homeless housing and services throughout the country. And when they have money that they want to give out into the community, for homelessness specifically, so I'll pause here and say they have it's a huge department, obviously. They have lots of different programs. So they have some programs that are just for low income folks, right? So you hear about like Section 8 housing vouchers, or they're actually now called housing choice vouchers. So that's for folks that are low income. It just helps you pay your rent. There's no services attached. You get on a waiting list. You could wait for 7-8 years. Once you get a housing voucher that pays for the majority of your rent, then you could basically stay on those programs for as long as you're eligible. And with those, you pay 30% of your income. So if you have no income, then you don't pay anything. So, but HUD also has a specific track of funding that is just for homeless housing and services, and they call that program the Continuum of Care, and it's called a COC. And so the way it works is it's been every year, actually they're moving to every 2 years, which is great. They say, communities that want this money, you have to build this special kind of a structure, a special kind of bucket that we could pour money into. And in that bucket, you have to have a few things, including it has to have a geographically defined boundary. So for a lot of places, that's just a county, and other places it'll be, a couple counties that come together. Sometimes it's just a city if it's a really big city. You have to have basically like an advisory board or a governing board that's going to help make decisions about how the funding gets allocated, because there's different kinds of projects that are going to apply for this funding. You have to have a special kind of a data system set up. So it's called the Homeless Management Information System. And that's really important, because that is HUD is saying you have to gather certain kinds of data from all the people that you're providing services to, and then they want reports, right, about how their money's being spent. So like, how effective have these programs been? How is this community doing in terms of addressing homelessness? And so HMIS, every continuum of care has to have that kind of a system. And they don't tell you what software you have to have, but they tell you kind of like what data points you have to be gathering, and there's a lot of restrictions around that. And then you have to have like an agency that's sort of the lead agency with, that's kind of the liaison with HUD. The other thing they say for COCs is you have to do this thing called a homeless point in time count every 2 years. They do it on odd years, because what they do is that becomes your official number of how many people are homeless, because they know that different communities may do sort of different levels of competence in terms of like gathering the data, or they may not have very good reach, right? So maybe a community doesn't have a lot of outreach, so they might not be capturing a lot of folks that are unsheltered in their data. So what they say is, for a homeless point in time count, you have to do this thing every 2 years, where and they give just some real basic guidelines about how it works. But essentially they say, pick any day you want in the last 10 days in January. And they do that because most people in colder climates are going to be indoors, right, at the end of January. So they say, indoors, like in a shelter. So you have, you do a count of who's in the shelters. You pick one night you want in the last 10 days in January. You do an inventory of everyone that's in your shelters. That's called a HIC, Housing Inventory Count. And then you pick the next morning, typically is how it works, is like at ass o'clock in the morning. You have a whole bunch of community members and maybe service folks that you have gathered. You've trained them, and you go out and you do what's called an observational count. So this means literally you're training people to go to different areas And you go and you look and you're literally like tallying, how many people do I see? This looks like a person in a sleeping bag. This car looks like there's probably people sleeping in it. And so people are getting training on like, how do you identify if it's like, you know, a fancy RV that's in a driveway in a fancy neighborhood versus like, you know, parked on a side street. And then after that observational count, within 2 weeks, we actually do a subset of actual surveys where we go out and we actually talk to people. So that observational count, you have no contact with people. You're not engaging with people at all. It's literally just observational, just to get literally like a head count. And then 2 weeks later, and this is what we do with service people, is like our service providers. We then have a set of questions, a survey that asks more demographic questions, also like, you know, what led to people's homelessness, do they have any of XYZ conditions, all that kind of stuff. And what I will say about the point in time count is the way I describe it is it allows HUD, the federal government, to compare apples to apples. So like, my county does this, the county next to us does this, the county next to them does this. So when HUD goes to pour money into these communities, they say, well, your count, you have, you know, X number. I think we had like 10,000 plus. Sorry, no, actually that's not true. I was thinking about our annual report. So say a community has 3,000 people that are counted during the point in time count, and the next county over has 5,000 people. The county with 5,000 people is going to get a bigger allocation. And so what I say is that point in time count allows HUD to compare apples to apples, but those apples are kind of rotten because it really does not capture the full magnitude of, or the full scope of what's actually happening in a community. That HMIS data is actually much more accurate. If you want to know like how many people over a whole year accessed services, how many, you know, men, how many women, how many trans folks, like what were the disabling conditions, all that stuff. But the PIT count is sort of like a snapshot, and that becomes sort of like the official number. And so they also look at trends, right? So that's where you look at trends of, you know, if numbers are going up and down, that's usually all based on this point in time count data. What makes me a little like, is there really isn't a lot of guidance about how communities are supposed to do that count. And so like our community, for example, we've gotten really sophisticated. We've invested, like a lot of communities will actually just like contract it out to an outside agency to kind of coordinate the volunteers and do the process and the report. And that makes a lot of sense because this is a fuck ton of work. But in our community, we work with our like GIS, the Geographic Information Systems team. We have these like this special app, and we do a lot of work to canvass our entire community. You know, we have the whole community broken out into these little grids. And for other communities, it's maybe not as sophisticated or as super detailed, and so their numbers might not be as accurate. But also, we also miss when you do this observational count. Like I've heard that there are, for example, a lot more folks living in storage units, like you would rent a storage unit. Well, we're not going to be able to count them on the count because we can't see them. We're not going into storage units. We're just looking. If there's people living in parking lots, for example, like behind a shopping center, we'll see that. But if they're living in an abandoned house, if they're in in abandoned buildings or anything like that, we're not going to see them. The other thing I'll add is that for our purposes, for the HUD COC funding, they're very, very strict about their definition of homelessness. So you and I would think, a normal person, a lay person would think, hey, you know, I got kicked out of my house and I had to go move in with my mom. Like, I'm homeless. Or there are 20 people living in a 2-bedroom apartment. Well, they're homeless. Or like, but HUD says if you have access to electricity and plumbing and heating, they don't care about overcrowding. It's not that they don't care, but it doesn't count as homeless and having access to a lot of these housing programs. unless you are literally homeless, and they mean in a place not fit for human habitation. So that's the other thing that we're capturing in the point in time count, is that there are a lot of folks that don't actually, that maybe they're in really crappy housing situations, they might be at risk of losing their housing, they're living in substandard conditions, but to HUD, for this specific kind of funding that pays for, and I can talk about that in a minute, like certain kinds of housing and services, they're not going to be eligible. So the other thing I'll say is HUD funding under the COC pays for a couple of different kinds of housing. So one, the sort of like highest level of support is called permanent supportive housing. So that is, somebody has to be disabled, they have to have a documented disability, and they have to have been homeless for at least a year. And I won't go into the details, like there's a way to calculate that if it's not a solid year. But basically, they've been homeless for a long time, they are disabled, so essentially they're vulnerable. That kind of housing, it's called permanent supportive housing, or PSH. That is the most expensive. It is for the most vulnerable people. So it includes a rental subsidy, so kind of like those other kind of HUD vouchers. It's, you only pay 30% of your rent. Only pay 30% of your income, and they come with supportive services. So that usually looks like a case manager that's maybe sort of very involved, checking in on you quite frequently. If you have like mental health issues or substance use or hoarding, they're really trying to help you manage that. Their whole job is to really like keep you in housing. The next step down is what's called, it's not quite it is kind of a step down. So for people that need a little less support, it's called rapid rehousing. And that means you are, I think about it like training wheels. So if you get into a rapid rehousing program, the idea is you're eventually going to be able to sort of like ride on your own. So it's a rental subsidy and case management at the beginning, and it's usually kind of really intense at the beginning. And then that tapers down over time. So, and the person is like, the client is aware, and they're really working on like building up the person's resources and skills, right? So maybe they need a better paying job, maybe they need to get connected in with, healthcare, maybe they get connected in with food stamps, all these things that might help increase their income, and help them be able to pay for, rental services on their own. So that's usually that's time limited. So it's usually like between 6 months to 18 months, those programs will taper down. HUD used to pay for more for things called transitional housing. They've really, really dialed back on that because, so transitional housing is typically like, 18 months to a year. You would be like in this program, but you aren't going to be able to stay there. You're going to eventually have to move and leave the program. They really hold on to that now, mostly for specific subpopulations. So for transition age youth, like young adults, where you're really trying to build up their skills. Some for veterans, and some for maybe folks that have are leaving domestic violence, for example. But HUD really doesn't pay for that kind of a program anymore, because the philosophy is really that the solution to homelessness is permanent housing. It's not shelter. It's not, temporary situations. It's housing. So we know that those other things are really important, but when HUD is trying to figure out, like, where do we invest? Basically, what is the most effective investment of the resources that they have? They really are focused on funding permanent housing solutions. And then HUD also does have some of, like, in our application for funds, they have in a communities application, like there's a chunk that's set aside for sort of some like basic direct services on the ground, but like they don't pay for shelter. They do help pay for like our some of our street outreach services, and also like the sort of coordinating of things. So there's like a whole team of people that helps coordinate when people are in need of services. We have a whole systematic process for how you assess somebody and get them, figure out what their needs are, and then prioritize the most vulnerable. We also, like, they fund prevention. So if there are people that are at risk of becoming homeless, you definitely want to prevent somebody's homelessness if you're able to, if that's possible, because it's way less expensive to prevent someone's homelessness than to get them back into housing and then help manage like all the trauma that they've endured, because homelessness is traumatic. It really is. So that's my spiel so far. Happy to answer questions that people may have. Enjoy.